This is an instructional video on how to give subcutaneous fluids at home to your own pet. To start off, we have the bag of fluids itself. It is a total of 1,000 milliliters in each bag, and I'm going to instruct you how to open it. There's a small pull tab here on the top, and it will also come with this IV line as well as needles. So when you're opening it, you're going to pull this tab, and you do have to pull kind of hard, and it will peel off. This area right here in the center where it's not covered is a sterile area, so you want to make sure that you don't touch that with your hands at all. And same goes for your line here. This tip here, there is a plastic cover on it, and this is what's going to go inside the bag for the fluids to come down through. So you're going to take that off. Again, be sure not to touch the top there because it is a sterile area. And you can see there is a small hole there, and this tip is going to go directly into the hole. You have to use a little bit of force, and there it is. And then on the line, there's a small plastic piece that will restrict the flow through the line, and that'll tell you whether it's open or closed. And right now it's open, you want to close it. And then you'll take your needle, and at the other end of the line there is also a cap. Again, underneath this cap is a sterile area. Be sure not to touch it with your hands. And we're going to open the needle, and there is a screw top here, and you're just going to screw the needle on the top. And a good way to tell if your needle is sterile or not, whether you changed it, leave the cover on if it's a sterile needle, and if it's not, then take the cover off. And once the needle has been used once to give sub-Q fluids, it is no longer sterile. And then we're going to hold the bag up, and because I closed the lines, the fluid will not come down through. When you're ready to use it, you can roll that right back up, and you can see it'll now flow through the line freely. And then you can close it back to stop it. And then I'm also going to demonstrate now how to give sub-Q fluids on your own pet. And this here is Riley. He comes in a few times a week to get fluids. So these are his, and the line is currently closed. And because this needle does not have a cover on it, like this one, I'm going to assume that this needle is not sterile. So we're going to take that one off, and we'll discard of it properly in a sharps container. This cannot go in the trash because it is considered biohazardous material. So we open that, being careful again not to touch the tip of that, and screw the new one on, and that is now a sterile needle. So for giving the sub-Q fluids, we always like to go right between the shoulder blades, just under the skin right here, because that's a much less sensitive area for the patient and they don't feel it as much. So what you're going to do, you'll take your fingers, you'll pull the skin up and create a small tent there, and we're going to place the needle right in the tent. So do that. Expose the needle by taking the cap off, and then we'll make the small tent. We'll place that directly through the skin. And as you're doing that, be careful not to go through the other side. Once you start letting the fluids go through the line, if you feel fluids coming out, that means you've punctured all the way through, and you'll need to reposition your needle as to not go through the next layer of skin. So once you open the line and the fluids initially start flowing, it is very cold, and a lot of patients will react to that, so do be prepared for as soon as that goes through, they may have a slight reaction to it. We're going to go ahead and on each time you give the fluids, you're going to look at the bag and see where it's at when you first start, and each bag is labeled with different numbers to indicate how many milliliters are left in each bag. So right now it's at 3.5. So we're going to give 100 milliliters. So we're going to go past the 4 into the line between the 4 and the 5 to give a total of 100 milliliters. And then I'm going to open the line, and now the fluids will start flowing freely. And then once I've given that whole amount and it's down to the line that I've indicated as for me to stop at, then I will close the line back up and I will place my finger. A small bubble will start to create, and that will be absorbed slowly by the patient. And you'll place your finger directly here, pull the needle out, hold your finger where the needle was for just a moment, and that'll allow the skin time to close back up so that the fluids will not continue to leak out. Now, even though you do that, you may tend to have a pinkish hued small amount of fluid leak out. That is normal, and it's nothing to be alarmed with. And that's it.